Where do you see yourself with Hexa Prevention in the next 5 years, sir?
To your audience, I would like to give a message that so-called allopathic medicine is all about prevention. So we are trying to go back to the roots and give to the people the benefit of the full spectrum of services. For a country the size of India, it is a subcontinent. The penetration of insurance should be at least 90%. Our endeavor is to increase the health insurance penetration by increasing the coverage, but reducing the premium. Individual like an equal partner in the endeavor, not the doctor giving the orders sitting on his high throne and expecting the people to obey. Here we involve the client as an equal in a participative manner. So this is what it is all about.
Very insightful and very interesting to hear about it, sir. Uh, Definitely a much needed effort in today's life, sir, because considering the amount of sickness that has increased compared to the previous years, and there is an increasing need for preventive health. Definitely, I can understand that the big players and the big corporate hospitals thrive on sickness. To some extent, doctors thrive on sickness too, but it would be a fitting thing to focus more on prevention than cure, because we are also taught initially in our MBBS days that prevention is better than cure. Somehow we seem to have lost focus on that.
In fact, during our undergraduate days, I found it very interesting. I don't know whether you noted it or not. As far as the WHO is concerned, or as far as the your textbook of preventive medicine is concerned, all healthcare, all medical interventions at every level is preventive. It is either primary prevention, or it is secondary prevention, or it is tertiary prevention. So if it is primary prevention, if you are preventing the disease in early stages, before it has taken root. It is secondary prevention if you are doing intervening at a stage which can be called prodrome. It is the disease itself is subclinical, like in the case of diabetes, hypertension, or in fact everything what we are doing in Hexa Preventia, it is in the realm of secondary prevention. But WHO says that even when you are when you are taking out a gallbladder, for example, which is after cholecystitis and gallbladder stones, you are exercising tertiary prevention. You are uh, trying to prevent a morbidity called gallbladder rupture and the resultant catastrophe. So when you are taking out a tumor, you are trying to prevent mortality and morbidity. So it is all prevention.
Definitely, sir. That I should admit that this I had not given this thought, but now that you have put it out, it it is an eye opener, sir. That everything is basically prevention.
So to your audience, I would like to give a message that so-called allopathic medicine is all about prevention. So we are trying to go back to the roots and give to the people the benefit of the full spectrum of services what are available in the modern scientific medicine. And we need your best wishes and help, support, and whatever guidance you can give is most welcome.
Definitely, sir. It was an honor talking to you about all these preventive health aspects, sir. I have a couple of questions, sir, before we wind up. Where do you see yourself with Hexa Prevention in the next 5 years, sir?
We shall be having a health insurance company of our own, which will be extending the full scope of preventive healthcare services. And we shall be having pan-India presence. And the health insurance penetration today is only about 5%. I mean, all the government schemes, central government and state government schemes, this yojana, that yojana, if you take out that, if you include that also, it works out to be about 25% or thereabouts. Still right? But even then, it's a very small number. For a country the size of India, it is a subcontinent. The penetration of insurance should be at least 90%. Our endeavor is to increase the health insurance penetration by increasing the coverage, but reducing the premium. How? By reducing the claim rate, by successful preventive healthcare in a objective manner. We call it accountable wellness. Wellness which is accountable, which is answerable. Not wellness that we are giving you wellness, rest is left to your luck and your stars. No, here it is accountable. If either you, with our efforts, you will stay healthy and well and out of hospital. And if you end up in hospital, we or someone on our behalf will pay your hospital bills. So accountable. So I foresee that if in 5 years' time we are able to increase the insurance penetration in India by a figure of 20%, it will be a satisfying achievement.
We would definitely hope that you would achieve this target, sir, and we are very positive about it. Sir, a final question, sir.
Your best wishes.
Definitely, sir. Final question, sir. Looking back at your journey, sir, from military service to private practice to international experience and entrepreneurship, I would like to ask what keeps you motivated even today, sir?
Yeah, it is a very good question you asked. In fact, I'm very happy you asked this. You see, when I was doing my MD medicine, in those days I started becoming acutely aware of the vast potential of preventive healthcare. And in those days, I was young and inexperienced, and I was bubbling with energy, and I wanted to reach out and start it as a rather than regular clinical practice. I wanted to offer it on commercial lines to the whole country. But it was in those days that I started realizing that I shall be competing against people who are providing wellness with marketing glitch and glamour, and it's not easy to compete against them. How to make your wellness accountable? So while working, so I one thing kept buzzing in my head, that if you can't sell it to anybody, if nobody else will accept it, damn it, at least you can give it to yourself. You can give it to your family. So I started preventive healthcare on myself and on my family. At least the people who listen to me, nobody else listens to me. So with God's grace, I've been fairly successful. I'm approaching 70. I'm 69 already, and enjoying the peak of my health. And with God's grace, I can look forward to a health span of about 100 years. That means active professional life, during which I'll be able to do all that what I have tried to explain it to you. So I hope I'll be able to. So then I can feel the satisfaction of having led a successful life.
Sir, I'd like to contradict, sir. You have already led a very successful life. Anything, anything you do from now on is going to be a cherry on top, definitely. And I really hope, I really wish for you to achieve whatever lifespan you have in target for the next 30 years. And we would like to see Hexa Preventia reach really at a very high level. And I have a belief that definitely it will reach, sir. And I would like to repeat this, sir. You don't look like 70 at all, sir. Talking to you makes me feel very old. Matlab, I'm very honest about it.
Okay, that's very encouraging.
A lot of
Thank you.
enthusiasm, sir. A lot of enthusiasm, and I take back a lot of energy from you. Since we have witnessed something like Operation Sindoor in the past, sir, and you have been a part of armed forces since long, and I still believe that the roots are still connected. So, any message for the armed family, sir, armed forces family?
Yeah, I loved my days in the army, and I left the army with a heavy heart. It was because my wife is also a doctor. Her career was suffering. So I had to take a call. I had to take a harsh decision. But my heart is with the army. Army way of life. Once you are in the army, you're always in the army. You can leave the army, but army doesn't leave you. So it lives in your heart. It lives in my heart. And I'm a soldier at heart. And I'm very proud of Army, our armed forces, Army, Navy, Air Force. We should be very proud of them, and we are blessed to have such armed forces. I must share the message.
That was very kind of you to provide us your valuable time, sir. And we learned a lot in the journey. I learned a lot, and I have definitely taken a lot of inspiration from you. And you're 70 years young, sir. You're not 70 years old. You're just 70 years young, and you still have a lot of you still have a lot of time. And we would like to see you reach more heights.
Yeah, so we'll keep in touch, and I would like to draw a youthful energy from you to keep going. Thank you,
Definitely, sir.
Dr. Abhishek.
Thank you. Thank you very much for your time, sir.
God bless.
Thank you for listening to MedHustlers. If you liked what you saw, please give us a like, a share, and a comment. Thank you. And also, please subscribe us.